you to some brand new coronavirus details right here in Georgia. Today, more than 2,800 new cases were reported, bringing the total to 170,843 confirmed cases. Sadly, 11 more deaths have been reported, increasing the statewide death toll to more than 3,500. And right now, more than 17,000 people remain in the hospital.
Our Yasmina Alston has been digging into those numbers all day, and she's trying to show us what they mean for our state.
She spoke with an expert from Johns Hopkins University today about the latest surge of cases. And Yasmina, you have brand new information this hour.
Sean, that's right. Dr. Amesh Adalja says the pandemic has clearly not been controlled in many parts of the country. He says, including here in our state of Georgia. And while now some people are calling for another shutdown, others are saying we should look at certain factors. Rising coronavirus numbers continue in Georgia. According to the state's Department of Public Health, there are over 170,000 confirmed cases and over 3,500 people have died. Stats by Johns Hopkins University breaking that down, listing Fulton and Gwinnett in their top 50 for confirmed cases by county, both with over 15,000 confirmed.
Look at the percent positivity of tests, it's in the teens. We really want test positivity to be less than 5% to show that you've got control. And it is a heterogeneous outbreak in the country as well as in the state of Georgia, where there are some counties where there is much better control than in other counties.
Johns Hopkins senior scholar Dr. Amesh Adalja says Georgia's outbreak is not as controlled as it needs to be. He tells me we will continue to see more cases, hospitalizations, and a considerable amount of deaths. 11 deaths were reported as of Monday in the state. While Adalja says as a whole, we have better tools now than we did in March, there is still specific work to be done, especially as states are reopening.
We still don't have the capacity to test, trace, and isolate, so we are still allowing chains of transmission to occur that land on vulnerable people.
According to Adalja, we must look at what activities are contributing to the spread.
Maybe going to a bar contributes to spread, but doing house painting or going fishing does not. So I don't think that we need blanket shutdowns.
And Dr. Adalja says the coronavirus will probably be with us until enough of the population is vaccinated. He says in the meantime, we of course must keep washing our hands, wear a mask, and keep your distance from others. Live in Atlanta, Yasmina Alston, CBS 46 News.
Yasmina, thank you.